Hello everyone, back to me again to this topic, the last topic of this semester, entitled Loss, Grief and Bereavement. Please grab your notes and pen and write everything that you want to write, and you can also use the forum discussion for any questions that you have, or we can meet during the in-person class. So the topics that we will discuss for this week, including the first one is bereavement theory, coping with the loss, helping the bereaved, grief care and support, and the last one is grief services and support. As the introduction, all those left to grieve will experience many similar responses to their loss. So no matter what is their loss, they will experience 1, 2, or 3 symptoms that are similar. The experiences of observing grief following death will vary depending on your situation. Loss and the associated feelings of grief are very universal. So grief itself is focused on the internal, intra-psychic process of the individual, of a person. Grief is a response to the loss of someone or something that was very important for them. It's the intense and painful pining for and preoccupation with somebody or something that was with them but now is lost, or to whom or which one was attached to them. Grief can occur after a death, divorce, illness, or other significant loss, such as unemployed or job loss. Grief can affect the physical and the mental health of the individual. The experience of grief can be very different for everyone. In the next slide, we will discuss about the losses that patients may experience. The first one could be health. So when you are become sick, you may be hospitalized or staying at home, which unattach you from the activity that you usually do. You also can lose your self-concept, losing your sight or hearings, losing your spouse, husband, wives, partners, losing one of your member in the faculty or one faculty member, losing your dignity. So especially for someone who are dying, they sometimes lose their dignity due to the healthcare professionals. Lost your security, family members, lost your friends. This could be not always become due to the death, but losing friends could be, you are unattached from your friends. Let's say your friends become far away from you. Losing your home, let's say it's because of the fire. Losing your body image. If you're losing one of your organs or one of your extremity, like losing your leg, or let's say it's losing your one of the breasts because of the breast cancer. Losing of the communication, become not able to speak, companionship, and finances. There are some factors affecting complicated grief. The first one, whether the death is expected or unexpected. This means a sudden or violent death. An unexpected or violent loss, such as a car accident or homicide, increases the risk of the complicated grief. The personality of the bereaved. This could be a close or dependent relationships with the deceased or someone who died can increase the likelihood of complicated grief. The bereaved gender or age. This could be, someone or a child, a family member, but he or she still very young or a child because of the disease or complications of the disease. The religious belief of the bereaved. This could be, when someone who bereaved has different religion or belief with someone who dies. And the amount of social support of the bereaved. If you are become so individual, maybe when you um, die or closing to death, there might be not so many people or community comes to support you and your family members. So this could be a complicated grief. So there are many kinds of grief. You can also read from the Google that maybe you're very common with anticipatory grief and complicated grief, but actually there are some more of the kinds of griefs. So the first one, cumulative grief. This kind of grief happen when we experience an overload with one loss piled on top of the other. So let's say losing someone that is very important to you, and then you lose your job, become unemployed, or losing your family members or spouse. So losing one after the others. This could be a cumulative grief. The second one is anticipatory grief. This grief can happen with you when you know that the loss is coming. So anticipation, anticipatory grief. So you know that the loss is coming, which you may prepare yourself. Let's say one case, um, family member or loved one having a cancer diagnosis, being not certain with the treatments in the future, but you may can guess that something is not right with the treatment or with the condition, and then you may think that, oh, maybe soon or later the death will just approaching or come. So you being anticipated of those things. Chronic grief, when we experience a very painful loss that cannot be changed, and it's very difficult to to move the grief. This kind of grief doesn't decrease over time and is marked by the intense of the feelings or grief that persists. Chronic means that you lose or you lost something, you lost someone that is very important for you, and you feel it like every time you just feel it. Complicated grief occurs when layers of unfinished loss and trauma contribute to other losses. This become disordered thinking. You may showing a very reactive behavior that leads to a very complex interactions or feelings. And we discussed the factors that contributing to the complicated grief in the previous slide. Collective grief, when the community experiences the same losses, there is a sense of collective grief. Let's say um, you know losing family members because of the pandemic, just like COVID. We lost so many people. We lost the healthcare professionals, we lost the family members, or maybe our friends. So this could call a crisis, a collective crisis, grief, like happens in the community or even all over the world. The next one would be types of grief. Another types of grief is normal grief. This grief begins soon after the loss, and the symptoms may go away over the time. Breakup grief refers to the grief that experienced by someone or individual at the end of their relationships. And traumatic grief could be, a very sudden, unexpected death of the loved one. So did not expect it before. Here are some of the common grief experiences. Feeling as though purpose has been lost. When you lost someone that you love very much, you may have no intention to keep up your life because you think that you lose your purpose already because of that someone that you love or very important to you. You may experience a physical pain in your body, that you don't know why and how it happens. You may experience a fatigue, become sensitive to light. You want to stay in a very dark room and quiet. You might become very clumsy. You did not pay attention to your self-care. Wearing the diseased clothes, maybe you're wearing the t-shirt, the pants of your loved ones, and then you may be crying, panic, confused, become disorientation. You have a very low, or even the opposite, become very high motivation, lose of the energy, not able to be focused. And if it's become so chronic, then someone who bereaved maybe has a thought of suicide. Now moving on to the mourning. Mourning is emphasizes on the external or public expressions of grief. These could be influenced by one's belief, religious practices, and cultural context. While bereavement is the state of sadness and grief following the death of the loved one. So us nurses are well placed to offer early bereavement support and understanding because many people begin their bereavement in the company of nurses. So most bereaved people grief is a normal reaction that they are able to manage themselves with the support of good family and friends. Bereavement theories and models have evolved over time, and it is true to say that grief is much complex than any model can allow. So maybe you know this already. Kubler-Ross. She was a Switzerland psychiatrist who first discussed the theory of 5 stages of grief. I believe that you ever heard about this. She was dumbfounded by the hospital treatment of the dying patients. She started giving lecture about patients who do not have hope to live. And then she also wrote some books related to the death and dying. So this are the stages of grief: denial, anger, bargaining, depression, and acceptance. So if it's I think I have the tips for you to remember these things. So just remember, in bahasa Indonesia is dabda. So DABDA, dabda, denial, anger, bargaining, depression, and acceptance. We will discuss one by one. Denial. Many people experience denial as the first stage in grieving. So when they having lost, they might believe that something is not right. So they might think that, oh, this must be a mistaken, this is not right, and then they refuse to to accept or to acknowledge that this is actually happened to them. So they feel denial after let's say it's a diagnosis. They feel denial after the death of someone, and they feel numbed inside of their body, and they refuse to accept if their loved one being diagnosed of a chronic disease, or refuse to accept that their loved one is gone. So this is a very first stage of the grief. The second one is anger. This could be happen if someone could not hold with their denial feeling after the loss. So they often feel angry, get frustrated, and they might get very angry to the community, to the people around them who get close to them. So they might also have the questions inside their mind, like asking why this happened, like this is not fair, why me, why my mom, why my dad. And they're looking for someone who needs to be responsible and to blame. The third one is bargaining. This is something that really an avoidance. The individual may try to avoid the cause of grief, like being around the family or around the place of death. They may even try to change their own behavior, and they might bargain with the situation. Let's say, if I get my life together, maybe this pain will go away. If I do the right things, this might not happen to my mom. If I become so, you know, very diligent or obey, my dad would be so happy, um, you know, having me as his kid, something like that. So become bargain with the situation. The fourth one is depression, the stage which most people associate with the grief. This could be the emotion that not felt right away. They maybe felt, the combination of the previous stage, like anger, and other stages. So they might withdraw from the things around them. They might experience something or some symptoms related to the depression. Not able to eat, not cleaning themselves. They did not pay attention of the self-care and others. The last one could be acceptance. In this stage, the individual might not necessarily feel less sad, but they will say, it's going to be okay, and I can do this, I can fight this, and I can get through this. So become accepting, but might still feel sad because of the loss, and maybe they become a bit calm in this stage and stable in the emotional stage compared to the other stages of the grieving. In addition, there are four phases of grief based on John Bowlby. He was a British psychologist and psychiatrist who was a pioneer of attachment theory in children. So he also had the four phases of grief, including shock and numbness. The second one is yearning and searching. The third one is despair and disorganization. And the last one is reorganization and recovery. Shock and numbness could be phases with there is a sense of the loss that feeling not real and seems impossible to accept. This is quite similar with denial by Kubler-Ross. And in this stage, there is also a physical distress during the phase, which can result in somatic symptoms. While yearning and searching is accurately aware of the void left in the lives of the lost, the future may be imagined is no longer a possibility, but they starting to search for comfort, from the person that they lost already, and they try to fill the void of the loss of someone that they love. If in yearning and searching, if they cannot progress through this stage, they might spend their life trying to fill the gap, fill the void of the loss, and remain preoccupied with the person that they have lost. So they have to, moving on and finish with this stage. Otherwise, they will start to, filling the blank, filling the void of the loss. The third one is despair and disorganization. In this stage, someone might accept that everything has changed, the role has changed, and they will not go back to the way they could imagine. They might feel hopeless and despair with this condition, may get anger also, and questioning why this happened and why this is happened to my mom and why that and everything. Life feels as though it will never be improved and make sense again after the person they love died. They might get withdraw from the others too. The last stage from Bowlby is reorganization and recovery. So in this phase, an individual start to their life start to be restored, and they might develop a new goals and start to rebuild their life together and realize that after the loss something can be also be positive, and they slowly restore their trust to everything. Now, moving on to principle when carrying people who bereave. Just remember that being grieved is individual. Even though you have experienced um, a bereavement or being grieved of someone that you lost before in your previous life, but remember that your feeling of grief, your experiences might different with someone else who are grieved right now. So that is very individual. We would like to treat them, the family members or friends or whoever in the community that feeling grief, um, make them special. So um, respect them for being the grief and respect them for showing their experiences of grief. And there are many factors that can influence the expression of loss. Someone can be very, like maybe you think that someone being so dramatic or exaggerating, but as I mentioned before, grief being so individual, so other person could be not that cry so much, but for the particular person they might cry so much and being so quiet. And it is important to validate and listen to their thoughts. Just borrow your ear and your shoulder to be, to listen to their griefs, to listen to their sense or feelings, and validate their thoughts. Do not expect that the bereaved to forget the past. You cannot do that because let's say you can easily forget the the past or something that you lost before, but it is not the same with other person or other individual. So do not expect or to rush them to just forget the things because life must go on. You cannot say that because that's not being caring or empathic to the grief people. And always remember that patience might be someone or things that have lost being so important for the individuals. So you cannot make the feelings the same. So as I mentioned again, grief is so individual. So you know at least you can look after yourself and your colleague if you experience so many loss of your patients, let's say, like in a single daily or basis. You lost your patients, then maybe you need to look after yourselves or your colleagues, so then you not become numb, but you still develop your empathy to the patients um, who died and the family members who grieve. You can help the bereaved by being there with them. You may not always say something, just be quiet and stay with them, provide them chair and you know provide everything that they might need, like water, tissue, a paper tissue, and be um, let them know that you are there to support them. And you may also bring the other family members to be together with the deceased body. Being not judgmental, because as I mentioned, it's being so individual, and the sense or experiences may be different, so you cannot judge them being so dramatic or exaggerating. Give them some understanding. They might need some time to be with the deceased body, so provide them room if it's possible. Close the curtain, provide the chair, drink, or whatever they need. that something is very caring and empathy during this very hard moment. And you may also encourage them to talk about the disease if it's possible. Maybe not in the first day of the death, but maybe in the next day or following days. Tolerate silence. It is not very important to speak so much to them, but just being familiar with the feeling of the bereaved people. But you also can provide silence during this moment, and just um, be mindful that you cannot make them better. They will find their own way to be better in their own sense and their own way. So you can also only provide the assurance to them. And if they did not want to talk, then you have to respect them and do not take anger personally. If in this moment they got very angry, then please do not take that personally. So how to help in the very very first days or few days? You can contact them. It is, if it's possible, as soon as possible after the loved one's death. You can send them text or call them through the phone call. If it's possible, you can attend the funeral, offer the support, and ask what would be helpful for them, for you to do, and what do they need. So just ask them and listen up to them if they ready to speak to you and if they want to be open to you. And please avoid any judgment to them. And it is very important at this time that you can provide the willing ear and provide your shoulder to they for they to cry on, and listening with very compassion heart, active listening. If you think that they are not ready enough to speak, then do not push them. Do not tell them about your grief experience personally, because it will be very different experiences, one and other. And do not compare your grief with other people. Do not tell them that your grief is wrong. You have to move on. This life is or let's say your children need you and whatever. So do not say that. That is very not empathetic ways of the nurses to say that. um, you know do not advise them of telling them this is the best way you can get over with your grief, or instruct them to do whatever you want. So just take it slowly and just be with them and listen to them. So these things might ever happen, or maybe you ever heard that, let's say, someone who lost the spouse, husband or wife, and then they say it's okay, you will get married one day again, you will meet another man or another woman. This is very an empathetic way to say that. And let's say if someone lost their um, family member, someone that they love, their moms or their dad, but they died, around like 80 or 85 years old, and then you say, well, she's very lucky. She lived to such a ripe old age. You cannot say that. Even though they died in a very old age, no one would like to be, feeling grief or being in bereavement stage, and none of us would like to lose anyone, especially someone that we love. So these things, please remember that these things are things that you cannot say to your patients or to your patient's family members or others. Let's say to your family members or your friend or the community. So just pay attention of these things, these comments that you have to avoid during the bereavement stage. And I think this is the last slide. So you can also find some support through the counseling. If you find someone that are very in need to be counseled, then you can also refer them to have counseling to someone that you know, or invite them to join the support group. This might help them, being together with someone who also in the bereavement stage or losing their family members. Or you may also can call support volunteers that can help them, doing the self-care or doing the cleaning in the house, or buy things for them while they could not attend to their personal care and needs. So these things are very helpful for them. So if you can provide this and follow up how they go, and this could be helpful so much. So yeah, I think that's all. If you have any questions, you can also use the forum discussion, or we can discuss during the in-person class. I hope you can also watch the other two videos in the Learn. There's a very nice thing to watch related to the grief and bereavement. And I think that's all. I'll see you again next time. Bye-bye.